and good afternoon and good morning and good evening to everyone. So let me start our meeting today. So dear honorable ministers and distinguished guests, I am Dr. Svetlana Axelrod, the director of the Global NCD platform department, which is placed in the headquarters in the WHO. And it's a great pleasure for me to welcome you today to the multi-stakeholder gathering hosted together with NCD Alliance and the World's Diabetes Foundation. We are waiting for the participants who are joining us today. We have more than 1,000 registration. So we are waiting for the participants who are joining us. I would like to take this opportunity and to invite you to see how the Global NCD platform department that I am leading works, and continue this collaboration with different stakeholders to address NCDs and mental health conditions, and also to share the risk factors. And let me ask my colleagues to present the short video for your attention. Still, we are waiting for the other participants who are joining us for this meeting.
For over a decade, heads of state and government have continuously reaffirmed their commitment to reducing the burden of non-communicable diseases and recognized the crucial importance of strengthened multisectoral, multi-stakeholder engagement and country-level action.
The strategic priorities of the Global NCD platform, developing the capacities of national policymakers and managers to address the ambitious NCDs and mental health agendas and to achieve the SDGs targets.
Non-communicable diseases, including cardiovascular diseases, cancer, chronic respiratory diseases, and diabetes, account for 71% of all deaths worldwide, with the burden falling disproportionately on low and middle-income countries.
The NCDs are affecting households, they're affecting health systems, they're affecting economies. Basically, they are the challenge of the 21st century.
The Global NCD platform leverages the convening power of the United Nations by bringing together the World Health Organization's Global Coordination Mechanism and the UN Interagency Task Force on the Prevention and Control of NCDs. Under the Global NCD platform, more than 450 GCM participants come together, with over 40 UN agencies under the UN Interagency Task Force to overcome the NCD challenge.
Empowering and coordinating diverse stakeholder engagement across the spectrum of NCD prevention and control is ensured through advocacy, collaboration, resource mobilization, and capacity building at global, regional, and country levels.
The real added value of the task force is that it supports and encourages a whole of government response and a whole of society response. WHO's real strength is its engagement with ministries of health, but the whole UN system, when it combines forces, has very powerful entry points and opportunities for engaging with ministries outside health.
GCM, the Global Coordination Mechanism, is a platform within WHO that supports stakeholders from across constituency base to come together to collect knowledge, information, resources, and will to support countries in effectively responding to the NCDs.
Many new exciting projects and initiatives are underway, creating solutions for multi-partner engagement. Advancing the converging Sustainable Development Goals, universal health coverage, and NCD agendas.
Let's act on NCDs together. As one, we can. Hope you enjoyed the short video, and I see that the number of the participants are really increasing. So a couple of housekeeping notes: that we have the interpretation today available for all participants in French and Spanish, and you will see the instructions on how to turn it on the chat. Also, we will provide the Portuguese interpretation, but only available for one of our panelists. So now, when you have looked this short video, you know aware about the Global NCD platform is bringing two very important secretariats: the Secretariat of the Global Coordination Mechanism and the Secretariat of the United Nations Interagency Task Force. And the main point of this aim of these two secretariats is to catalyze effective multisectoral and multi-stakeholder action for NCDs to prevention and control at global, regional, and country level. And I would like maybe to start today our discussion by saying that over the past decade, collectively, we had made tremendous progress in fight against non-communicable diseases and their risk factors. And just a couple of examples that, as you of course know, we had already 3 United National General Assembly high-level events and meetings. We have extended the Global Action Plan for Prevention and Control of NCDs till 2030, which is aligned with the 2030 Sustainable Agenda. We have extended the mandate of the Global Coordination Mechanism till 2030. We have also updated the WHO Manual of Policy Options and Cost-Effective Interventions for the Prevention and Control of NCDs, known as Appendix 3. We launched the NCD Implementation Roadmap 2023-2030, the Global NCD Compact, and the Global Group of Head of States and Governments for the Prevention and Control of NCDs. And we have launched the Framework for Meaningful Engagement of People Living with NCDs and Mental Health and Neurological Conditions. Also, and finally, we have established a multi-partner trust fund, as we call it, Health for Life Fund, together with 2 other UN agencies, UNDP and UNICEF, to promote global solidarity for impactful actions on NCDs and mental health, where it is needed most in middle and low income countries. So yes, and we have a lot of things to do, and we have evidence show that the global commitments have not fully translated into actions and impact in many countries. As the global leaders in health and beyond are mobilizing collaborative actions and reaffirming their commitments, these coming weeks in the margins of the 3 health-related UN General Assembly high-level meeting in New York, which will be very soon next week. And I believe our multi-stakeholder gathering offers an unique opportunity to fit into and strengthen these agendas, bringing the global NCD response to the forefront of the 3-level actions on UHC and overall 2030 Agenda for Sustainable Development. Effective and inclusive NCD responses require collaborative, coherent, and sustained actions across government sectors and non-state actors. The need for strengthening engagement across sectors and stakeholders has been increasingly recognized and endorsed by the global health community, and the WHO member states made a request to our Director General, Dr. Tedros, for WHO to conduct an analysis of successful approaches to multisectoral actions for the prevention and control of NCDs. The WHO Global NCD Platform, through the Global GCM, has taken on this task, and today we are launching one of the key products within this initiative, the Global Mapping Report. You will learn more about this important milestone from members of my team later today in our agenda. Our regional colleagues will also provide regional perspective of the importance of building capacity for multisectoral and multi-stakeholder actions on NCDs. And importantly, we will hear from our countries across the globe about their experience in developing and sustaining multisectoral responses to tackle NCDs and mental health conditions. The outcomes of our discussion today will be also feed into the second annual gathering of the global group of head of states and government for NCD that will be next week in New York. I encourage all our participants to engage in today's discussion through the chat and Q&A that will be at the end of our discussion. Before we will proceed to the agenda, we also would like to share you a brief message from our Director General, Dr. Tedros.
Non-communicable diseases are the leading cause of premature death and disability worldwide. The second United Nations High-Level Meeting on Universal Health Coverage is an important opportunity to drive progress in the prevention and care of NCDs. We call on governments to advance universal health coverage by investing in equitable and accessible health systems that meet the needs of people living with heart disease, cancers, diabetes, respiratory disease, and other NCDs. There are many examples from around the world of countries making an impact on NCDs, using a whole of government and whole of society approach and engaging people living with NCDs in a meaningful way. WHO is committed to supporting all countries to use the many tools available to prevent NCDs and save lives.
As it was highlighted just now by Dr. Tedros, they're very important. We can't achieve UHC without attention to NCDs. And I'm happy to note a very important development for the Global NCD platform. This year, we joined the WHO division of the Universal Health Coverage, Communicable and Non-Communicable Diseases, as we call it, UCN. And now I'm very honored to give the floor to Professor Jérôme Salomon, the Assistant Director General for UCN. Professor Salomon, thank you very much for joining us today, and over to you.
Thank you very much, Svetlana. Excellencies, honorable ministers, distinguished guests, dear colleagues and friends, good morning, good afternoon, and good evening. It's my pleasure to welcome you to this second multi-stakeholder gathering on tackling non-communicable diseases taking place in the margins of the health-related UN General Assembly high-level meetings in New York. It's an honor to co-host this event with our long-standing partners, the NCD Alliance and the World Diabetes Foundation. The high-level meeting on universal health coverage is a milestone opportunity for all stakeholders to reaffirm and act on the interconnected commitments to achieving universal health coverage and Sustainable Development Goal Target 3.4 on non-communicable diseases. The crippling burden of NCDs and mental health conditions continues to jeopardize our ambitious agenda for universal health coverage. The main NCDs, namely cardiovascular diseases, cancers, chronic respiratory disease, and diabetes, still account for over 74% of global deaths. Each year, 17 million people die from an NCD before age 70. And over 3/4 of these deaths occur in low and middle-income countries. While the COVID-19 pandemic has further undermined progress towards UHC, it's the continued global rise of NCDs, particularly in low and middle-income countries, that poses the most severe and underestimated threat to offer quality, safe, effective, affordable, and accessible healthcare for all. I remind you, however, that global NCD and mental health targets are not just aspirational, but achievable for all countries. Effective NCD prevention and control requires leadership, coordinated action across government sectors and health sector actors, as well as continuous engagement and partnerships with civil society, people living with these health conditions, and with relevant private sector entities. Our joint action on NCDs and mental health is also an investment in a more resilient global health architecture. Effective integration of NCD prevention and control and the promotion and protection of mental health requires a radical reorientation towards primary health care. This is the very foundation to spur progress towards universal health coverage, as well as to ensure health security and achieve health and well-being for all. Today, I am happy to see so many committed voices coming together from across the globe, representing government sectors from health and beyond, as well as trusted civil society partners. By sharing their knowledge and experiences, they are leading the way to further build countries' capacity for a whole of government and a whole of society response to NCDs. To catalyze effective multisectoral and multistakeholder responses to NCD prevention and control at global, regional, and country levels, WHO established the Global NCD Platform Department, which has recently taken stock of these diverse country experiences and insights on governance and leadership for multisectoral and multistakeholder collaboration on NCDs and mental health. We will hear firsthand from some of these country experiences today as we celebrate the launch of the WHO Global Mapping Report on multisectoral actions to strengthen the prevention and control of noncommunicable diseases and mental health conditions. It's inspiring to see such strong and continued commitment and engagement from all of you. Your examples demonstrate that it's feasible for countries to accelerate their capacity in multisectoral and multi-stakeholders collaborations, provide strategic leadership, and promote policy coherence and coordinated and effective whole of government and health in all policies approach. I look forward to receiving the key messages and calls to action from today's discussion. They will feed into the upcoming second annual gathering of the global groups of heads of state and government for NCDs, for the Global NCD Compact. WHO deeply appreciates this high-level political support and acknowledges it's critical to reaching the global NCD targets and reducing premature mortality from NCDs by 1/3 before 2030. I would like to thank you again for joining us today, and now turning it over back to Svetlana to facilitate the meeting. Thank you.
Thank you very much, Professor Jerome, and thank you very much for the opportunity to welcome our panelists. Let me ask all of you who is available to switch on your cameras for the memory of our meeting today. I will ask it to show you on the screen. Yes, so nice, familiar faces to see. Thank you very much. And I hope my team is available to make the screen photos. Then we can have in our memory. So thank you, Jerome, and you really highlighted how it is important to engage with the people, with their life experience. And it's my great pleasure that today we have with us a very distinguished person, Heather. She is from Zimbabwe and representing the International Diabetes Federation, Federation's Blue Circle Voices Network. And I'm really honored to welcome her today and to give her a floor and to get some remarks from your side. Over to you, Heather.
Thank you very much for this platform. I would like to start by saying all protocol observed. I just have 3 minutes to talk about the issues of availability, affordability, and accessibility to treatment and supplies for NCDs in general and diabetes in particular. I've been living with type 2 diabetes for almost 10 years now. So I do have that kind of experience. And thank you for honoring our lived experience and for giving us the platform. I would say that the issues of availability, accessibility, and affordability are the 3 key issues to equitable healthcare faced by people living with non-communicable diseases in most low to income, medium income countries, Zimbabwe included. The economic situation in some of these countries of ours is dire, and the majority of people live below the poverty datum line. So that means people with chronic illnesses have to pay directly for their supplies and for their medication and treatment because our governments hardly subsidize or provide these services at a low or at no cost at all. I want to speak particularly about insulin, which is a drug that people with diabetes rely on. For someone with type 1, they have to have insulin in order to survive. And we also have an increasing number of type 2 diabetes also relying on insulin, myself included. Insulin is very expensive because it has to be imported from outside the country. And we do have occasionally some programs of free insulin, but these are often not sustainable, and they often cater for a very small number of the people affected. So this leads to many people having to go without insulin, rationing their supplies, and this leads to poor health outcomes and to premature deaths. In terms of accessibility as well, we do face some challenges, especially in poor areas where we have poor road networks and where people have to travel long distances to access healthcare. And this has an impact on their accessibility for healthcare, for medication, consultations, and so on. I would also like to point out that diabetes is also a risk factor for many other conditions, including conditions like dementia. And it is important that people are informed of the importance of keeping their diabetic condition in control to reduce the risk of developing dementia as well as other non-communicable diseases. And in terms of calling for action, some of my recommendations, I would say that international health organizations, I'm calling them to commit to support the manufacture of essential medication, including insulin, in low-income countries, if they can commit to invest in that so that medication becomes cheaper and easily available on the market for the local people. And also, I'm calling on our governments to subsidize essential medications so that the costs are at least affordable to the majority of the people, especially those on the lower end markets. And for those that are especially vulnerable, I'm calling that essential medications should at least be given for free for such type of people. Thank you for the platform.
Thank you very much, Heather. Thank you very much. And really, I want to say that for GNP, for Global NCD platform, it is the key stream to work in building the capacity for meaningful and sustainable engagement of people with their lived experience on NCDs. And it is very important that we will have the joint health solutions, how to promote the health. Thank you very much, Heather, and it's really a great pleasure that you joined us today. Let me go to our next distinguished guest and our good friend, our host, Katie Day. Katie is the CEO of the NCD Alliance, and NCD Alliance is an established civil society partner who was supported WHO in shaping the major milestones in NCD agenda. So over to you, Katie, and thank you for joining us today.
Thanks a lot, Svetlana, and good afternoon, everybody. Thank you to WHO and the World Diabetes Foundation for partnering on this important event today. Thank you to the Ministers of Health and Government who are joining us, and thank you to you all for joining us today in the audience. It's great to be convening today at this event as the 14th of September marks the start of NCD Alliance's annual Global Week for Action on NCDs. This is a really special week in the year when the NCD community mobilises from global to local and calls for action on priority issues. This year, the theme is Bridging the NCD Care Gap to maximise the opportunity of the UN high-level meeting on UHC in New York just next week. And the campaign has one clear message: the moment of caring about NCDs and universal health coverage is now, and calls upon everyone everywhere to take action and be an agent of change. From posting on social media to contacting your local politicians and policymakers to organising an event in your community, no action is too small, no voice is insignificant. And I really encourage everyone on this event and this webinar to join the campaign and to take action. For NCD care and all aspects of the NCD response, NCD Alliance has long been advocating that mobilising multi-sectoral responses by governments and multi-stakeholder action with all relevant stakeholders has to be the focus and the foundation for achieving the global NCD targets. Obviously, seeing NCDs within the context of the 17 Sustainable Development Goals really reaffirms the need for all of society, all of government approach, and needing to leverage the links between the 17 SDGs and health and non-communicable diseases. This is not a nice to have, it's a necessity to work synergistically to focus and invest in the win-win solutions with multiple benefits for health and development in the round. For governments particularly, all levels and diverse ministries need to be involved well beyond health. As we all know, although NCDs wind up in the health system, their drivers and determinants are driven by sectors well beyond the economy, trade, agriculture, education, urban planning, transport and the environment, you name it. And as so many of the policy solutions require leadership from these ministries across government too. And at the heart of this, policy coherence is absolutely essential, but in equal measure, hard. I've worked in government, I've got the T-shirt, and I appreciate the challenges in policy coherence, but it undoubtedly requires leadership from ministries of health that we'll be hearing from today, and at the highest political level of governments, heads of government, heads of state, to push for leadership and accountability from all government departments on NCDs. But beyond government, we all know that action on NCDs takes a village. It takes all sectors, civil society, academia, relevant private sector, communities, people living with, to make a difference, and well beyond our NCD community as well, engaging the broader global health and development community, as I mentioned. And we really believe that we have to bring this approach to the fore of our advocacy efforts as we move towards the UN high-level meeting on NCDs in 2025, the fourth, just a couple of years away from now, and a really major opportunity to create more action and commitments from governments. So thanks again, and I look forward to the discussion today. Back to you, Svetlana.
Thank you very much, Katie, and big thanks to you and all your team for all your efforts in organizing this event with us and also with the World Diabetes Foundation. I would like now to give the floor to Bent Latrop-Nielsen, head of the global policy at the World Diabetes Foundation, a long-standing supporter of the WHO NCD work. In particular, World Diabetes Foundation's support has been instrumental to the development of the global mapping report that we are launching today. So Bent, please, over to you.
Thank you very much, Dr. Axel Roth. On behalf of World Diabetes Foundation, I express our sincere gratitude for the opportunity to co-host today's multi-stakeholder gathering together with the World Health Organization and the NCD Alliance. We are, of course, encouraged to be part of this important event. But most of all, we're excited about the opportunity to showcase examples from countries from different parts of the world and learn from them more about how they have progressed multi-stakeholder and multisectoral responses to NCDs. Ever since the first UN high-level meeting on NCDs back in 2011, and all the way to the Global Declaration on Universal Health Coverage, we have known that prevention and control of NCDs is a task which cannot be solved by the health sector alone. And we also know that to prevent and control NCDs, many stakeholders in a community or in a society must be engaged and involved and take ownership. So we need whole of government and whole of society approaches. But there are many questions to be addressed, and there are many dynamics to be considered. How is tobacco control related to physical activity and to social determinants of health? How is food policy related to education and to prevention of diabetes? And how is mental health linked to primary level care and to national health budgeting? You could go on, these are just a few examples. There are so many interconnections and the complexity is very high. So what really matters is the actual progress we can see in countries and in communities, what has worked. And of course, what also matters is our ability as a global community to converge our effort and join forces and support countries achieving the NCD targets. As said by Katie, we're just a few days away from the UN General Assembly, which this year has a very critical and high-level meeting agenda on health and universal health coverage. So today's event brings to the global stage examples of some of the solutions we need, but hopefully today will also be an inspiration for a much wider and accelerated progress of multi-stakeholder and multisectoral action so that the NCD targets can be achieved worldwide. I think with these words, I'll give the word back to you, Dr. Axelrod. Thank you again.
Thank you, Bernd, and thank you very much for your support and collaboration for AGID that we have. And thank you, of course, for your colleagues who are working with us very closely. So on this stage, we have to conclude our opening session. And now I'd like to pass the floor to my colleague of the Global Coordination Mechanism, the head of the Secretariat, Dr. Guy Fawkes. He will facilitate the discussion that is following after our opening remarks. Guy, the floor is yours. Over to you.
Thank you very much, Svetlana, and a warm welcome and good day to all our esteemed participants. We have just heard of the ambition and vision from WHO and key partners, including the power of lived experience that has paved the path for crucial high-level commitments for NCDs. But today, we also hope to bridge this vision and these commitments with country-level experiences, good practices, and concrete actions that showcase the feasibility of moving from that commitment to ultimate impact at national, subnational, and community levels. We want to provide a platform for countries to share the how-to and the impact of multisectoral and multi-stakeholder actions. And we are certain that this knowledge collaboration will build further capacity for leadership at all levels, governance, accountability, and sustained resources. And it's my pleasure that as we move our attention to the country experiences, we will first touch base at regional level with insights from 2 WHO regional offices. It's a pleasure to welcome Gordon Gallia, Strategic Advisor to the Regional Director at WHO's Regional Office for Europe. Gordon.
Thank you, Guy. Thank you to the organizers and to the participants, the large number of people attending enthusiastically. As director of NCD and myself, a person with lived experience, a recent cancer survivor, I'm conscious of time. Time is our scarcest resource. We have 105 weeks left to the UN high-level meeting on NCDs in 2025. And just half of that before we have to report on Europe's and each country's achievements on the NCD targets in the SDGs. The perma-crisis works against us. War, earthquake, the hollowing out of health services. These impose a policy overload, reduce the attention available to NCDs, even if these conditions remain by far the biggest killers in a complex of interconnected, wicked problems. In WHO Europe, we are responding with a dual-track response under the headings of a 100-week challenge leading up to the UN high-level meeting 2025, let's call it Race to the Finish, and a longer-term generational action looking at shifts beyond up to 2050. Each track has its own shifts that we need to consider in regional and national programming. As we race to the finish in 2025, we look at 4 shifts in emphasis. We need to focus on premature avoidable deaths from cardiovascular disease, cancer, other NCDs. Premature deaths from NCDs must feature much more strongly in our national strategic programming, and multisectoral action is crucial here. We must focus on quick buys, asking which of the best buys adopted and expanded by the World Health Assembly will render the fastest improvement in outcomes before 2030. We must focus across the whole disease pathway, universal health coverage, and NCD action to encompass all opportunities for improvement across the whole natural history of these diseases, seeking opportunities for action at all levels of the health system, from primary healthcare facilities to regional specialist centers. We must focus on impact. We need to shift our information systems from NCD tracking and surveillance to analysis, to prediction, embracing digitalization, artificial intelligence, producing reports that demonstrate impact, not only process. A genuine whole of society solution cannot be limited to the next 7 years. We need to look forward to a Europe that is NCD resilient, carbon neutral, secure, and at peace. Such a vision will be larger than NCDs alone, than the health sector alone, or one country alone. Of particular interest to the NCD community in Europe in the years leading up to 2030, NCDs and emergencies, and the commercial determinants of NCD. The clock is ticking, and each country must again commit. What core actions will we take together across the whole of society as we race to the finish? Thank you.
Thank you so much, Gordon. Extremely impactful intervention, and your vision is so powerful. Ultimately, the clock is ticking, the urgencies are compounded, but there are possible solutions, there are frameworks if we have that broader vision, a long-term vision. That's exciting. And Gordon, looking forward to seeing how Euro continues this framework. Our next speaker is Anselm Hennis, Director from Non-Communicable Diseases and Mental Health from the PAHO office. He will connect with a video message, and I hope we can connect that video. Yes, we are. Thank you.
Ladies and gentlemen, distinguished guests and fellow advocates for health and well-being, I am truly grateful for this opportunity to share insights from the Americas about building capacity for sustained multisectoral actions as we work collaboratively to prevent and manage non-communicable diseases and address mental health conditions. Previous speakers have eloquently highlighted why a multisectoral approach is paramount in disease and mental health conditions. We all understand that these challenges require comprehensive and sustainable solutions grounded in solid evidence and driven by the objective of protecting health as a public good. NCDs, including diabetes, cardiovascular diseases, cancer, chronic respiratory diseases, and mental health conditions, continue to adversely affect our populations, healthcare systems, economies, and even national development. Additionally, the significant impact of mental health conditions on overall well-being is also being increasingly recognized. These issues transcend borders and demographics, necessitating comprehensive and multisectoral approaches that address root causes, not merely symptoms. Capacity building for sustained multisectoral actions must be the cornerstone of our efforts. It empowers countries and communities in taking control of their destinies in health, creating a continuum of action across education, healthcare, policymaking, and community engagement. This approach allows us to better address the complex factors driving NCDs, such as unhealthy lifestyles and the social and commercial determinants of health. I'm honored to present two inspiring examples of the endeavors of the Pan American Health Organization and its partners in addressing NCDs and mental health conditions while building sustainable capacity. The first example is our collaboration with the Organization of American States, or the OAS, in NCD prevention, with a focus on preventing obesity in children and adolescents through school-based interventions. The region of the Americas is the most overweight and sedentary of the 6 WHO regions, with overweight and obesity in childhood, adolescents, and young adults being a health crisis. Our joint efforts under the Inter-American Task Force on Non-Communicable Diseases have led to impactful policy dialogues, fostering discussions on implementing the plan of action for the prevention of obesity in children and adolescents. This initiative is pivotal, especially in today's world where school environments promoting healthy eating and physical activity are now more critical than ever. We're making significant advances with the implementation of the Inter-American Policy on Healthy Food and Physical Activity Policies in the School Environment 2020 to 2025. This program, driven by capacity building and technical assistance, aims to support countries in advancing their policies for healthier school environments. The second example showcases our partnership with the Healthy Caribbean Coalition, or HCC as it is known, a collaboration that extends across sectors throughout the Caribbean sub-region, including non-state actors, academia, civil society, and the business community. Working collaboratively with the HCC, the Pan American Health Organization champions the right to health and access to accurate information about food products by advocating for mandatory front-of-package warning labeling in the Caribbean. This partnership has yielded impactful media campaigns such as, now more than ever, better labels, better choices, better health. Now more than ever, we need to protect our children, and the food in our school matters. Additionally, we continue to conduct joint workshops and webinars, informing the public while building the capacity and reinforcing our commitment to reduce childhood obesity and protect the health of our children. These examples exemplify the transformative power of collaboration between governmental and non-governmental entities. They underscore that when we need to unite our resources, expertise, and determination to drive policy changes that safeguard our children's health and promote overall well-being. As we reflect on the work of the Pan American Health Organization and its partners, let us remember that reducing risk factors for NCDs and achieving better care for those living with NCDs and mental health conditions is a shared responsibility, one that demands sustained commitment, innovation, and adaptability. In conclusion, I urge all of us to recognize the pivotal role of building capacity for sustained multisectoral actions in preventing and managing NCDs and mental health conditions. It is not just a responsibility. It is an investment in the health and well-being of our communities and nations. May these examples inspire you to continue collaborating across sectors and with diverse stakeholders. Together, we can break boundaries, build bridges, and overcome even the most formidable health challenges. Thank you for your unwavering dedication to a healthier future and your commitment to sustainable multisectoral and multi-stakeholder collaboration. Thank you.
Thank you so much, Dr. Hennis. Very powerful examples from PAHO on how to, two initiatives which really address a growing epidemic, contextual epidemic in the region, and which is unfeasible, unsustainable without multisectoral action. And I also note your call for building capacity for that sustained multisectoral action. I think we'll see insights of the entry points for the capacity building when we go to our country experiences. And with that, without further ado, this is the important, the DNA of today's event, is to relook at and hear from the insights on countries on the feasibility and successes of multisectoral actions. Before we go, just a brief housekeeping. I remind all that there is a chat room and a Q&A room. Please use the chat room to provide any comments, resources, networking, general information, and respect the Q&A room for specific questions you may want to pose to the panelists and general audience. Remind the interpretation, and we will now move into the three panels that we have structured. The three panels touch on some of the enabling factors, key enabling factors for that multisectoral action and multi-stakeholder collaboration, and pinpoint entry points for what Dr. Hennis has pointed towards, that needed capacity building on the ground, not only at national, but very importantly at subnational and in many cases at community level. Our first panel will touch on governance, leadership for that multi-stakeholder and multi-sectoral action. We have three esteemed panelists. We have the extreme honor of launching this panel with the presence of the First Lady, Her Excellency, Dr. Isaura Nyusu, First Lady of the Republic of Mozambique. We will also hear from the Honorable Minister of Health and Human Services of Palau, Gafar Wed Palau, and we will also have insights from the Deputy Director of Public Health of Tasmania, Scott McEwen. Let's, if you will, the first slide. We will now open up for a very important key message from Her Excellency, the First Lady, Dr. Isaura Nyusu. So she will join us with a recorded message. If we could have that now, thank you.
O êxito da luta contra o cancro do colo do útero rumo à sua eliminação exige vontade política, compromisso do governo e ações multissetoriais que envolvem vários setores que podem desempenhar papéis importantes de apoio e complementares. Sendo Moçambique um país em franco desenvolvimento econômico, com um elevado fardo de cancro do colo do útero, a liderança e o empenho da Primeira-Dama nos esforços para combater este tipo de cancro desempenha um papel crucial através da coordenação ativa com o envolvimento de todas as partes interessadas, desde a definição de políticas, legislação, planificação conjunta das intervenções, bem como o envolvimento de todos na implementação e monitoria efetiva. Desde a sua criação, o objetivo do Gabinete da Primeira-Dama tem sido patrocinar, promover, monitorar, encorajar e galvanizar parcerias nacionais e internacionais para encontrar soluções dos problemas que afetam as pessoas mais vulneráveis. Com o aumento dos casos do cancro do colo do útero, assumi a responsabilidade de intensificar a defesa e a liderança a todos os níveis, como patrona, com vista a eliminar o cancro do colo do útero em coordenação com o setor público, a saber, área da saúde, educação, gênero, criança e ação social, bem como o setor privado, sociedade civil, membros da comunidade, parceiros de cooperação e doadores anônimos. Estabeleceu-se assim o grupo multissetorial e, dentre várias ações, mobilizou recursos e conhecimentos especializados para fazer avançar o objetivo da eliminação do cancro do colo do útero, melhorando a saúde pública em geral no país. Com esta liderança ativa, realizamos progressos consideráveis no que se refere à eliminação do cancro do colo do útero. Por exemplo, a vacina contra o papilomavírus humano, HPV, foi incluída no programa alargado de vacinação e introduzida nas escolas a fim de imunizar as raparigas e sensibilizar os professores, alunos e suas famílias para a prevenção e combate do cancro do colo do útero. Além disso, foram introduzidas serviços de prevenção primária que consistem no uso de métodos de alto desempenho para o rastreio e tratamento de lesões precursoras do cancro do colo do útero nos cuidados de saúde primário, com ênfase na qualidade e na cobertura, o que levou a um aumento de acesso das mulheres ao rastreio do cancro do colo do útero. Neste processo, o acompanhamento e avaliação da colaboração multissetorial são cruciais para garantir progressos contínuos na implementação dos planos e ações multissetoriais. Igualmente, a divulgação de informações relacionadas com o cancro e as campanhas de sensibilização nas línguas nacionais têm ajudado a aumentar a compreensão e a evitar o estigma e a discriminação contra as mulheres e as famílias, suas famílias. Uma forte governação e liderança a todos os níveis facilita o trabalho do grupo multissetorial através da legislação, políticas, planos e ações efetivas que apoiam os mecanismos de coordenação e proporcionam um ambiente adequado para a eliminação do cancro do colo do útero. Além disso, os sistemas de saúde que já estão sobrecarregados beneficiam de ações multissetorial com um uso adequado de recursos e impacto nas populações vulneráveis. Lanço um apelo ao Grupo Mundial de Chefes de Estado e de Governo envolvidos nos programas de combate às doenças não transmissíveis, DNT, para que no seu compromisso político de alto nível estejam cientes e reconheçam que as DNT continuam a ser uma das questões de saúde pública mais preocupantes em termos de desenvolvimento. Chegou o momento de agir coletivamente e comatar as lacunas na prevenção e resposta a este problema. Devemos pautar pela implementação de ações multissetoriais baseadas em evidências que já comprovamos a sua efetividade para salvar vidas humanas. Isto inclui a garantia de recursos e capacidade técnica coerentes em todos os setores governamentais e o envolvimento ativo de intervenientes governamentais e não governamentais, bem como das comunidades.
Thank you so much, Your Excellency. It's impressive demonstration of high-level political will, commitment that not only triggers multi-sector action, but enables the sustainability and resources for such action. And it's important to note that the Office of the First Lady provides strategic leadership to Mozambique's multi-sectoral group for cervical cancer elimination in collaboration with many ministries, Ministry of Education, Ministry of Gender, Child and Social Action, civil society organizations, community-based organizations, but very much collaboration with the Ministry of Health. And we have today also joined us the Honorable Deputy Minister of Health, Ileshe Vinodrajani, who will be available maybe to follow up with any particular questions or additional resources on how this very important collaboration has triggered considerable progress in addressing the elimination of cervical cancer in Mozambique, due in main part due to the leadership role and the sustainability and commitment of the First Lady. Thank you so much. And we'll move on to the next panelist, Honorable Minister Hubert Lau. It's an honor to have you. Welcome. Showcasing a rare high-level political commitment, a national coordination mechanism for NCDs was established in Palau by presidential executive order to oversee and mobilize political commitment and resources and coordinate and implement the national strategic plan for NCDs, including its monitoring and evaluation. But importantly, an NCD fund is managed by the coordination mechanism and financed by appropriation of 10% of revenues generated from taxes on alcohol and tobacco, providing funding aligned with the NCD strategic plan. The coordination mechanism is composed of members from all 8 government ministries and 2 semi-government agencies, as well as 24 civil society and development partners. What a better demonstration of multi-sectoral, multi-stakeholder. Honorable Minister, could you please provide insights on how Palau convened the necessary political commitment at the highest level to launch and sustain this national coordination mechanism? What are the key elements of such leadership, commitment, ownership, and sustainability? The floor is yours.
Thank you so much, and good morning, good evening, and good afternoon to everybody who's joining this very important convening. Thank you to the organizers and co-hosts for the opportunity. Indeed, it takes a lot of political will, as we heard from the Honorable First Lady. It takes a whole of government, whole of society approach. And for Palau, we did declare a national state of health emergency in 2011 through executive order on NCDs. And about 3 years after that, we realized that the Ministry of Health and the health sector cannot and should not be alone in trying to address NCDs and the NCD crisis. And so in May 2015, as you mentioned, through presidential executive order, this national level task force, if you will, was created to ensure that we have an overarching body to make sure that we have that whole of government, whole of society approach to addressing the NCD crisis. And as you mentioned, there's numerous members that's comprised of government ministries, civil society organizations, as well as traditional leadership that have a seat at the table. And we try to ensure that we cover all the sectors, from environment to fisheries to agriculture to education, culture, traditional laws, to ensure that we get the best ideas and feedback from the people who represent the most affected by the NCD crisis. And so that was 2015, and in the 8 years since the National Coordinating Mechanism was established, we have since identified the crucial tasks and functions needed in the continuum of NCD prevention and control framework, from health promotion, health protection, to clinical referral processes, to palliative care, to NCD survivorship groups. Those are all taken into account as we implement local level plans that align with global frameworks and sub-regional efforts to address NCDs as a global crisis. But we're also wary of the ever-changing nature of NCDs and the emergence of new threats to our efforts in addressing NCDs, including, of course, the COVID-19 pandemic, the impacts and threats of climate change, and how they further intensify the social determinants of health and how they affect various communities. And so with this, in Palau, for us, this means that as we look forward to better solutions and strategies, and as we look further upstream with NCD risk factors, we also need to look upstream in our health system to ensure that we are continuously realigning, reorganizing ourselves to ensure that our systems and structures, our policies, our resources remain effective and efficient in our efforts to address the progression and evolution of the NCD crisis. And so this year in July, we reissued another executive order with minor tweaks and changes to ensure that we remain, we'll try to remain one step ahead of the NCD crisis. So July this year, we revised our composition. We revisited the functions and the objectives of the coordinating mechanism to try to keep ourselves updated with what's really needed.
Excellent, Honorable Minister. Thank you so much. Amazing insights. Allow me to land on two, a very important one. You said this was all triggered by the announcement of a state of emergency at national level. And that is very, very impressive because the global community, civil society in particular, and specifically those with lived experience of NCDs and mental health have been calling for that state of emergency to address the NCDs for the last 10, 20 years. It's impressive to see that has then translated at national level to have this broad, sustained response, and that sustainability through that executive order, I see has permitted the expansion of this initiative to not only address vertical interventions, but look at those cross-cutting upstream social determinants that really will make the difference in the long term. It's impressive, and that again, the attention and commitment of high level to that state of emergency on NCDs and mental health is impressive. Thank you so much. Our next speaker from Australia is the Deputy Director of Public Health, Scott McEwen. As you see there, Scott, welcome. The Tasmanian state government has developed the Healthy Tasmanian Plan, which engages all government departments and sectors and works with communities to improve health and well-being. The plan included the establishment of the Premier's Health and Wellbeing Advisory Council. The council provides high-level and inclusive leadership to advocate for multisectoral action for health and well-being beyond NCDs and mental health across all levels of government and society. It engages community leadership to influence government activity, builds champions, and advocates for effective action across sectors such as education, transport, planning, and social policy. Deputy Director, could you provide insights on the value and impact of such high-level leadership that can catalyze both the Tasmanian Healthy Plan, but also the establishment of a high-level premier coordination body as a Health and Wellbeing Advisory Council? This is a valuable advice to other governments looking to foster that high-level accountability and coordination platforms.
Thank you, Guy, and thank you for the opportunity to showcase some of the work that we've been having underway in multisectoral action to address NCDs in the state of Tasmania in Australia. We have found leadership at all levels of government and across the community has been very important for effective multisectoral action in Tasmania, in Australia. The Premier of Tasmania is the highest elected official within our state. And in 2016, the Premier's Health and Wellbeing Advisory Council was established to provide high-level advice on the coordination across government sectors and the community of action to improve health and wellbeing and on NCD prevention in Tasmania. That very strong authorising environment that is provided by our highest elected official, our Premier, has been instrumental for enabling multisectoral action. The Council also includes a diverse range of highly experienced community leaders, and this combination of both high-level government and high-level community leadership has really provided some significant impacts that have helped us join up action across different government departments within Tasmania. An example of the high-level impact of that this leadership has provided is the release of the Tasmania Statement, which is a commitment by the Tasmanian government to collaborate on long-term solutions to address complex social and economic factors that influence health and wellbeing and NCD risks in Tasmania. And the release of this statement has provided a very strong signal across government departments of the need for multisectoral action to focus on health and wellbeing. And what we have seen from the health department's perspective of this is this whole of government statement or commitment has really led to non-health departments who are developing very high, broad policies and strategies are starting to proactively focus on considering health and wellbeing and their impacts of their non-health policies, and they're starting to engage with our health department. So we're really seeing that combination of high-level government leadership and community leadership is really providing significant action across government departments in Tasmania.
Thank you so much, Deputy Director. Very, very important insights on the connection, the necessary connections between top-down and bottom-up sort of advocacy, interventions, and action. We started our event today with the voice of individuals with a lived experience of NCDs, which I think you're pointing toward the fact that this can mobilize broader resources, broader attention from beyond the health sector. The voices of communities is so strong. Very important takeaway message. There may be more, and I invite you to stay online and address any questions that may come up. Thank you so much.
Thank you.
We will move now quickly to the second panel, and I apologize for those online that we are slightly delayed in our program. I hope we can sort of respect a bit the timing, including my own timing in leading through the discussions. But we will open up to the second panel, which is Partnerships for Enhanced Impact. Government and civil society organizations coming together. How can civil society effectively support government efforts? And we have our esteemed three panelists. Sududu Seneviratne, Director for the Center for Complex Hormonal Disorders from the Faculty of Medicine, University of Colombo, Sri Lanka, Professor Kaushik Ramaya, Honorable General Secretary of Tanzania NCD Alliance, and Renata Couto, Executive Director, Instituto Desiderata from Brazil. Let's start with Professor Sudu. Thank you for joining. Let me give a bit of insights on the very impressive experience and case study that we have looked into from Sri Lanka. The Director General of Health Services in Sri Lanka, with support from the World Diabetes Foundation, established a program targeting vulnerable populations, which builds sustainable partnerships with sectors beyond health. Its objective is to develop and strengthen an integrated NCD approach with a focus on diabetes and its modifiable cardiovascular disease risk factors through a health promotion lens. The Sri Lanka College of Endocrinologists, which you represent, and Sri Lanka Medical Association acted as the implementing partners of a comprehensive school-based program focused on health education, behavior change, communication, and infrastructure development, which also involved a partnership with the Ministry of Health, Ministry of Education, and the Family Health Bureau. Professor Seneviratne, what role can non-governmental organizations like yours play in facilitating and enhancing that much-needed capacity for collaboration across government sectors and agencies?
Okay. Thank you very much for that kind introduction, and it's a great privilege and honor for me to be addressing this esteemed audience. So if I just introduce myself, I'm a clinician working with children with diabetes and obesity, as well as a university academic with a research background as well. So I represented the Sri Lanka College of Endocrinologists in this multi-stakeholder endeavor, where we were one of the main implementing partners. And I think one of the great things about being able to work with the ministries was that I think as clinicians, our college has about 35 members who look after all people with diabetes and NCDs, diabetes and hormonal disorders throughout the country. So we were uniquely placed to really understand the level at ground level, the burden of disease on individuals, their families, as well as the healthcare service. So, and then we as a person working with children, I was seeing very young people, as young as 10, 12-year-olds presenting with type 2 diabetes. So we really felt it was very urgent and very important to take this message across to other stakeholders so that we would join hands in prevention. And I think I have some take-home messages that I would like to share with you. We initially worked at different levels of school children, but I think our best impact was on our project, which focused on very young school children between the ages of 5 to 8 in grade 1 and 2. Some of this knowledge, we developed some novel interventional tools which used both, I've been doing focus group interventions for children with obesity over many years. So we use that clinical experience of what is happening at ground level in the community, what is encouraging these children to adopt unhealthy lifestyle. And we couple that with the educational psychology, motivational, educational psychology from the Ministry of Education. And we really focused on the message. So I think we tried very hard to make the message, looked at the end users and make the message very interactive, very engaging. And we found that what we see is many people know. We have a very good state education system. So many people go to school and they know about healthy, unhealthy lifestyles, but they haven't actually felt the impact of it and translated this knowledge to their daily lives. So we thought we should work with very young children. And our focus was not only to educate them, but also help them to self-monitor and kind of empower them as agents of change. I think the key messages, I do feel this is a best buy. This was a low-cost intervention which had amazing outcomes even beyond my wildest imagination. I am so happy that I had this chance to do this. I think we had the opportunity to, with the WDF funding, we could get people from illustrators, digital health experts to help us prepare very innovative tools. We used a very simple storybook and a sticker book to monitor the diet in children, self-monitoring at home using a sticker-based food diary. And I'm happy to share some pictures, if I may, on the chat showing these implementations. I think the other good thing that was, we did a pilot project involving 4 schools with 1,500 children. We were very involved in the project at ground level. Our field officers ran it or oversaw it, and we monitored the outcome. So at the end of the project, we were able to demonstrate immediate improvement in their self-reported food habits, as well as change in their BMI within the first year of life. And because we come from a low middle income country, we have undernourished children as well as overnourished children. And what we saw was healthy changes. Undernourished children also improved their BMI towards normal. So it was very effective, very low cost. And we also captured the outcomes on videos. And these outcomes, I think, helped to convince the Ministry of Education to then take it to a national level. And I think this was very, very important for long-term implementation. So this was a great, I think, victory where the Ministry of Education and the Ministry of Health linked up. And over the next couple of months, we worked with the Ministry of Education and educated all in-service advisors in the Ministry of Education in all provinces of the country to implement it nationwide. And we hope this will ensure the sustainability. And we think we need to actually calculate these sort of projects into the school curriculum to have long-term sustainability. Thank you.
Thank you so much, Professor, and congratulations. Congratulations on the impact and the leadership in providing this initiative. I connect your intervention with our previous speaker from Deputy Director of Health from Tasmania. As you both said, the trigger is not only high-level political leadership. That's very important to sustain and to evolve these initiatives. But it has to connect with those community needs. It has to connect with identifying those marginalized, underserved populations, and how that high-level political cross-sectoral commitment can then have impact on the ground. And I think NGOs, academic institutions like yours, have that very important value add, building that capacity to understand data, evidence-driven understanding of what's happening on the ground, where are those vulnerable populations, and how we can best serve them through these national initiatives. Excellent, thank you so much. Again, I invite you to stay online and hopefully address any questions that are relevant. We move on to our next panelist, Professor Ramaya from Tanzania NCD Alliance. Welcome, Professor. Good to see you. We understand that under the leadership of the Minister's Office, Tanzania is implementing the National NCD Program and the National Diabetes Control Program. The Ministry of Health and the Office of the Regional and Local Government chose the Tanzania Diabetes Association and NCD Alliance as implementing partners. Again, we've seen this in other initiatives, the leadership from civil society and NGOs to improve diabetes diagnosis and management by taking action at both national and local levels. The Tanzania Diabetes Association convenes a yearly multi-sectoral steering meeting in charge of strategic and policy aspects, as well as a quarterly program implementation committee that addresses bottlenecks and potential solutions. Impressive, showcasing how NGOs can take leadership in coordinating and delivering national programs. Professor, we have been, what have been those main lessons learned of having an NGO as a convener of a national multi-stakeholder coordination and implementation platform? And how have you been able to support those government efforts? Thank you. Go ahead.
Yeah, first of all, thank you very much for giving us the opportunity to present the Tanzanian case. I think what is important here is the build trust and the partnership. And I think right from the beginning, as a Tanzania Diabetes Association, when we wanted to start implementing the diabetes programs under the support of the World Diabetes Foundation in year 2002 to 2003, we had to start working through the different levels of the government and the local government and trying to convince them that the diabetes clinics are very important in the public sector because the burden of diabetes is increasing. And I think over the period of time, we were technically able to support the ministry to create the training tools to provide the SOPs for the clinics, but at the same time, expand these diabetes NIDAS clinics into the NCD care clinics. And over a period of 5 to 6 years, we started working at different levels of the public sector, at the tertiary care hospitals, at the regional hospitals, the district hospitals, and currently we have implemented a program whereby we have basically trained healthcare providers and provided tools for diabetes and NCD care for 700 primary healthcare centers. And I think this has been possible because right from the time of the inception of the program, putting up a
Professor Kaushik, we have lost your audio.
Implement strategies in place, the Ministry of Health and the implementation. And we are partners in implementation throughout the strategy. We do not go to them with a completed program, but we work with them in implementing the program, in conceptualizing and seeing what would be the possible bottlenecks which we could overcome so that we have a good implementation strategy. That also, as a part of the reporting of the program, when we started convening the meeting, over a period of time, the other partners also joined us, and that resulted into having a sort of a multisectoral annual meetings whereby all the partners implementing different various NCD programs were asked to join in. And even when the training manuals were being prepared, different specialities and different partners were invited to be part of the training manual. And we have one standard training manual for NCDs for the primary care, secondary care, and tertiary care. And I think it is trust, reliability, partnership, and being transparent in what you are doing, which brings about that effect.
Excellent, Professor. Thanks for the insights. Again, I think you touch on the urgency or the opportunity, the need to bridge those national policies and national commitments with contextual solutions on the ground. And civil society and NGO is so best placed to make that bridge and build that trust between national interventions and local and community impact. Contextualizing, adapting, and convening stakeholders. Civil society has an extremely important role there, and I think that the attention to your role has been identified by the Tanzanian government. Excellent, thank you so much, and congratulations. I'll continue, but please stay on hold if any questions do come up. Thank you, Professor. We move on then to, thank you. We move on then to our next speaker, representative from Brazil. We welcome Ms. Renata Couto from the Instituto de Cirata. Renata, a bit of intro. The Desiderata Institute is a Brazilian non-for-profit organization dedicated to enhancing the well-being of children and adolescents, with a particular focus on combating childhood obesity, which is a significant challenge in Brazil, as it is across the region. The Brazilian strategy to prevent and care for childhood obesity, Proteja, is a comprehensive multisectoral approach to tackle this epidemic. The program relies on robust multisectoral collaboration and cooperation among diverse stakeholders, including civil society, and involves various interventions across advocacy, policy change, and broader determinants that impact on enabling environments. Ms. Couto, how does the involvement of the Desiderata Institute contribute to the overall effectiveness of a Brazilian national strategy to prevent and care for childhood obesity, including supporting the accountability to those communities it aims to serve?
Bom dia a todos e a todas, boa tarde também a todos e a todas, não sei em que horário cada um estarmos. Gostaria, antes de mais nada, parabenizar a iniciativa desse fórum que é tão importante e também agradecer a oportunidade de partilhar a nossa experiência aqui no Brasil. Realmente, a obesidade infantil é uma preocupação mundial e, infelizmente, no Brasil também tem sido uma preocupação crescente. Nós estimamos que uma entre cada 3 crianças atendidas pelo Sistema Único de Saúde hoje apresenta sobrepeso ou obesidade. E quando nós pensamos em como que as organizações sociais, né, podem contribuir para esse desafio, acho que é importante também a gente refletir sobre o papel dos governos e das organizações civis. No Brasil, a gente já trabalhou muito com a ideia da organização civil atuar onde o governo não chegava, né? Então, atuar nas franjas da sociedade. Hoje, ainda temos esse papel, mas também estamos trabalhando muito mais como uma cooperação mais estratégica. Então, enquanto o governo ele tem o princípio da universalidade, ou seja, tem o imperativo de atender toda a população, as organizações civis elas podem trabalhar com grupos específicos, testando metodologias e desenvolvendo tecnologias sociais que possam ser escaladas. Então, esse tipo de abordagem cooperativa pode ser mais estratégica e ganhar mais saltos em termos de abrangência e efetividade de respostas aos problemas que nós temos hoje. Nós temos alguns exemplos, né, de políticas públicas que são originárias de metodologias que foram desenvolvidas em campos de organizações sociais. E um outro ponto também é no sentido que, como já foi falado, de criar essas pontes, né, com as comunidades. Então, as organizações sociais elas têm essa capacidade de enraizamento nos territórios, e isso traz não só um alcance, uma capacidade de diálogo local e criar um diálogo entre as partes interessadas, mas também uma familiaridade e um conhecimento legítimo das questões das comunidades. E eu acho que, para o Desiderata, esse conhecimento íntimo das questões é muito importante. Na obesidade, nós atuamos em algumas frentes. Uma é na formação dos profissionais de saúde da atenção primária. Nós apostamos muito na atenção primária como uma força muito importante nessa equação, porque é a porta de entrada das crianças, adolescentes e suas famílias no SUS. Então, é muito importante formar esses profissionais para sensibilizá-los sobre esse problema e também como poder dar instrumentalização para o manejo da obesidade e sobrepeso. Nós também estamos construindo um fluxo de atendimento específico, então, o desenvolvimento de uma linha de cuidado específica para o atendimento de crianças e adolescentes que tenham sobrepeso ou obesidade e que estejam dentro da rede do SUS. Um outro trabalho nosso também é o nosso compromisso em produzir e disseminar dados e informações de qualidade sobre esse assunto. Então, ainda é um assunto que precisa ser muito descortinado e trabalhado em vários níveis. Um exemplo disso é o panorama digital de obesidade em crianças e adolescentes, que é uma plataforma digital em que se pode acompanhar o perfil nutricional e o perfil de consumo alimentar no Brasil, por recortes de municípios, por faixas etárias, por recorte racial. Então, isso traz um panorama muito importante, e esses dados são a base para o nosso trabalho de advocacy. Então, o nosso trabalho de advocacy, a gente acha que contribuiu fortemente para a aprovação das leis de Niterói e do Rio de Janeiro, de restrição de venda de ultraprocessados nas escolas públicas e privadas, que é um exemplo importante para ser seguido não só no estado do Rio de Janeiro, mas por outras capitais e cidades do Brasil. Obrigada.
Thank you. Thank you so much, Renata. We were waiting for the interpretation to finish, and I think we may have caught our interpreters off guard. It's our issue here, Renata. In the translation, we weren't prepared for this interpretation, but we thank you, interpreters. You stepped in very well. Thank you for those insights, Renata. This is just a great demonstration of how an NGO, civil society like yours, has taken the leadership in providing capacity building resources to address one of the main epidemics, in not only Brazil, as I said, but in the region, and how that trust building with the government and with the communities and the other stakeholders is essential. And you're well placed in there to convene and connect and build on that trust and really provide contextual solutions. And your interventions and your policy areas are very related to the WHO acceleration plan to stop obesity. Really seeing an interesting connection of an NGO connecting to national priorities, bringing in global frameworks, and really understanding the local context to then connect all these dots and provide that needed impact. Congratulations. Thank you so much. We now finish that very important second panel, where we are understanding how collaboration between government and civil society and non-governmental organizations really works. And it was surprising to see that in many cases it works so well, and the trust has been built so well, that the NGOs are taking the leadership in national responses and really bridging national to local and to community levels. Impressive. Thank you for the speakers. We move to the third panel, where we look at perspectives from governments beyond health. So let's look how are other sectors engaging with the health sector, why, and what has been the impact of those engagements. We have three esteemed speakers: José Bejan, the Assistant Chief Statistician from the Statistics Canada; Aneli Lontog, Undersecretary for Road Transport Infrastructure, Department of Transport of the Philippines; and Mayor Fabio Medrano from Paipa, Colombia. We'll start with José Bejan, who joins us through a recorded message. Canada has demonstrated that the power of data can drive multi-stakeholder strategies and support effective interdepartmental governance, senior-level political commitments, constructive and genuine engagement with stakeholders, and that same data can focus on shared objectives. In 2019, a mandate letter from the Prime Minister of Canada requested the Minister of Middle Class Prosperity and the Associate Minister of Finance to better incorporate quality of life measurements into government decision-making and budgeting. Finance Canada and Statistics Canada were the lead organizations responsible for engaging with over 20 federal departments and agencies, collaborating to develop the Quality of Life Framework for Canada. Impressive, representing a broad range of sectors, including health, economy, environment, and others. Through a video message, Ms. Bejan will share with us the strategies she believes are essential to ensure collaboration, alignment, coherence, and trust across different sectors to address health issues.
Greetings. My name is José Bejan, and I am the Assistant Chief Statistician for Social, Health and Labor Statistics at Statistics Canada. Thank you to the organizers of this important event from the World Health Organization, the Non-Communicable Disease Alliance, and the World Diabetes Foundation for this opportunity to address those gathered today. Before I begin, I want to acknowledge that I am privileged to be speaking to you all from the unceded territory of the Algonquin Anishinaabe Nation, who have cared for and continue to care for this land where I am grateful to live, work, and play. The theme that I have been asked to speak to today relates to multi-sectoral engagement, something that I and my team have gained a great deal of experience doing in our work to build a national quality of life statistics program for Canada. Our mandate since 2021 has been to measure what matters most to Canadians in all domains of life: economic, health, environment, society, and good governance. This is a broad mandate that would be impossible to fulfill without an effective strategy for engaging across sectors. So, with the time I have, I want to share 3 lessons that we have learned about how to do this effectively. First, healthy partnerships are essential when working in a multidisciplinary space. To that end, our work has not been a top-down exercise. Our team continues to work shoulder to shoulder with our diversity of partners at every level of organization, always with the goal of listening to understand. In building these relationships incrementally over time, we continue to learn a lot about what others know about quality of life and how it is best measured. We approach our partnership work with humility and never assume we know best. This process of working in collaboration lends our work legitimacy and has given us important footholds in the decision-making process, allowing us to bring the insights that data provide to those who need them most, when they need them most, and ultimately make life better for Canadians through the power of data. We know that if our partners do not trust our process, they will not trust our product. And the best way to ensure that there is trust is through effective collaboration. This probably sounds familiar. It is the same spirit in which the WHO and its many member countries have gone about their own work in developing strategies to tackle the rise in NCDs. Second, having a North Star that everyone can recognize is critical. For us, that is the concept of good quality of life. Measuring quality of life in all of its aspects seems like a daunting task, and it is in many respects. But it is not so daunting when you have that North Star and everyone can see themselves as instrumental to a shared goal. On the flip side, it tends to be true that the more you move upstream to think about determinants of outcomes, the more things start to converge and look like they have a lot more in common than perhaps initially thought. That kind of upstream thinking about determinants is fertile ground for multisectoral action, and it is part of the value add of the public health experts who we work so closely with as key contributors within our constellation of partners. And third, it is so important to move beyond the subject matter itself and create space to tackle horizontal dimensions that cut across all domains of policy. Themes like inclusion and sustainability are relevant to all sectors, and we have had great success making those themes explicit topics for co-development with our partners. I was asked to conclude with a call to action. Having to choose just one, I would offer that when working across sectors, let's be more deliberate about bringing data sets together as a key feature of those partnerships as they form. When it comes to the tough challenges that involve multiple sectors like NCDs, let's be proactive about bringing data and evidence together to generate actionable insights. From my perspective, this is key to working in a multidisciplinary way towards shared solutions for complex problems. Thank you again for including me on this panel today, and I hope you all find the remainder of your dialogue productive and enjoyable. Thank you.
Thank you so much, Ms. Bejan, for that inspiring and very insightful intervention. And I will pick up a very important concept you promote, that for enhanced health outcomes, we require healthy partnerships. This is, I think, what this whole event is really about. Multisectoral and multi-stakeholders, about partnership across sectors, government sectors, and partnerships with those relevant partners beyond. Very important, and that the health and that trust building, shared goals, and attention to those cross-cutting themes that can be more fertile for those partnerships and for convening joint outcomes is so important. We will ensure forward your call for data-driven solutions, and that data and evidence can drive collaborations and impact. Thank you so much. We will continue with the panel with an additional recorded message from the Undersecretary Lontok from Philippines. The Department of Health of the Philippines has triggered significant multisectoral initiatives through the establishment of a Healthy Promotion Bureau. This has led to the initiative of two crucial programs related to active transport and healthy open spaces. These were possible through a joint administrative order to build these initiatives, and the collaboration is with the Department of Transportation, Department of Public Works and Highways, and Department of Interior and local government, together with the Department of Health. Very important cross-sectoral. We will listen to the video where Undersecretary will provide insights on what has motivated the Department of Transport to engage with the Department of Health in these programs, and how do these initiatives align with the broader goals of her department.
A pleasant afternoon to all from the Philippines. Over the past 2 years, the world has witnessed a radical transformation in how we live, work, and travel. The emergence of the COVID-19 pandemic has forced us to rethink our public transportation system, emphasizing the principle of moving people, not cars. The potential of public transportation to become a transmission vector of the virus led to reduced confidence in the use of public transportation in the country, affecting the mobility habits of daily commuters. As a result, there was an increased preference for private vehicles for perceived safety. This modal shift had several negative consequences, such as increased traffic congestion, air pollution, and sedentary lifestyles. These concerns have led to the implementation of relevant programs that have long been in the Philippines' National Transport Policy, which was issued 5 years ago. The pandemic has become an opportune time to launch the program, galvanizing further the wisdom of moving people more than vehicles. In 2020, the Interagency Technical Working Group on Active Transport, composed of the Department of Transportation, the Department of Health, the Department of Public Works and Highways, and the Department of Interior and Local Government, crafted the guidelines on the proper use and promotion of active transport during and after the COVID-19 pandemic. This pushed for providing safe infrastructure for active transport and promoting active modes of transport for commuters, including walking and cycling. To date, the department has established a total of 564 kilometers of protected bike lanes and is currently working on its expansion, spanning a total of 400 kilometers of additional infrastructure. We are also working on developing a master plan to ensure that there is an adequate investments for the same. Another program that is also a long overdue initiative of the department is the EDSA Busway project. It is being implemented in collaboration with the Department of Public Works and Highways, the Metropolitan Manila Development Authority, and private bus operators. This provides median lane for buses that allow faster and more seamless travel for commuters. During the peak of the pandemic, it has provided our commuters with a controlled environment to curb the spread of diseases. Stringent protocols were in place, including health screening and social distancing. Because of the implementation of this project, we were able to redeem public trust in public transportation, especially during the return of public transport operations, while we continued to recuperate in the context of a better normal. Currently, we are doing a feasibility study on the privatization of the EDSA Busway project as a means to further improve its services and also for proper maintenance. In conclusion, the COVID-19 pandemic has given us an opportunity to reimagine our cities and transportation systems. By embracing and promoting active and public transport, we can improve our health, reduce pollution, and create more livable, inclusive, and sustainable communities. It is not just a matter of transportation. It's a matter of public health, environmental stewardship, and a brighter future for all. Maraming salamat at mabuhay.
Thank you so much,
Over a decade.
Thank you so much, Undersecretary. Excellent demonstration of sort of identifying the co-benefits from the design to the implementation impact of these initiatives. That's what brings together those public sectors with joint and shared visions and joint benefits. We will move on quickly to the last speaker of this panel. It is my pleasure to introduce Mayor Medrano from the municipality of Paipa. Mayor, it is very important that the city of Paipa has adopted a visionary multi-sectoral approach to public management at the city level. This has resulted in the establishment of a collaborative initiatives where the Office of the Mayor has taken the lead in overseeing municipal government councils as coordinating committees. This approach has successfully engaged government officials from 20 public municipal agencies to work together with communities, utilizing data from the information system to inform and guide these actions. This has enabled shared information structure, which in turn empower leaders and knowledge sharing and decision-making platforms in response to community and individual needs. Mayor Medrano, could you elaborate on your vision as mayor, championing the adoption of such an innovative multi-sectoral approach to public policies that has fostered collective commitments and benefits to your community? Mayor Medrano, are you online?
Un saludo muy especial para todas y para todos. Quiero enviar un abrazo gigante a la Organización Mundial de la Salud, a la doctora Svetlana, nuestra directora de la Plataforma Mundial de Enfermedades No Transmisibles. De igual manera, un saludo muy especial a la Organización Panamericana de la Salud, a la doctora Gina Tambín, representante de la OMS en Colombia, al Ministerio de Salud y Protección de Salud en Colombia y de Relaciones Exteriores, al Gobierno Departamental de Salud, a los representantes de los países y a la comunidad en general. Es para mí un honor dar estas palabras y compartir el modelo que venimos desarrollando en Paipa, Colombia, precisamente representando a mi comunidad y demostrando que ha sido un privilegio servirle a todos a ellos y además en tiempos tan difíciles como ha sido el de la pandemia. Es de verdad una alegría inmensa y poderles contar que nuestra experiencia parte por reconocer la gobernanza en salud como un atributo fundamental para el logro de la equidad. Tradicionalmente los gobiernos locales planean de manera independiente las acciones de acuerdo a las competencias de cada sector del gobierno y esto limita a trabajar la salud en todas las políticas. En primer lugar, es necesario considerar dentro de los instrumentos de planificación local, como lo son el Plan de Ordenamiento Territorial o el Plan de Desarrollo Municipal, la salud como un eje transversal. Es decir, la planeación estratégica debe ser favorecer el planteamiento de estrategias en salud que operativa y financieramente comprometan a varios sectores del gobierno. En segundo lugar, partiendo de la premisa que los recursos públicos son escasos, fundamentalmente es importante considerar que hay otros aspectos importantes en trabajar, como identificar las necesidades y priorizar las acciones hacia lo que es normalmente los más vulnerables, las personas que esa brecha social ha generado mayor dificultad. Esto es reconocer la necesidad de no dejar nadie atrás, para lo cual es necesario saber dónde están, cuáles son sus necesidades y las expectativas más importantes que ellos tienen. Nosotros lo hicimos con el uso de un sistema de información que permite visitar periódicamente a estas comunidades y poder revisar además en qué condiciones se encuentran. Llegamos hasta el último rincón del municipio y de esta manera conocimos a detalle sus condiciones de salud, además las dificultades que estaban teniendo en materia de su presente y las necesidades que ellos tenían a futuro. De esta manera pudimos atender a las poblaciones socialmente más vulnerables del municipio y además tenemos hoy que esta disponibilidad del sistema de información, que es detallada y en tiempo real, nos permite activar un esquema de trabajo intersectorial para atender integralmente las necesidades identificadas. ¿Cómo desde mi papel como alcalde logro motivar a que mis secretarios de diferentes dependencias hablen de salud? Pues bien, viene desde el ejemplo. Yo particularmente llego al territorio, genero espacios de descentralización del gabinete, de los consejos de gobierno, llegando a la vereda, escuchamos al ciudadano y por supuesto atendemos sus necesidades que van desde la línea de educación, de medio ambiente, de agua, y de forma inmediata desarrollamos una directriz con cada uno de nuestros secretarios. Por supuesto, hay un puente de diálogo con la comunidad. Es el presidente de la Junta de Acción Comunal o el líder comunal que es elegido democráticamente. Así que ese flujo de información que nutre nuestro sistema de información viene representado de forma democrática y además generando un lazo directo con nuestras sectoriales o nuestro equipo de trabajo de la alcaldía. Por último, quiero enviar un mensaje muy respetuoso a todos los alcaldes del mundo, y es a dejar ese ego de poder a un lado. Normalmente se nos enceguece ese poder a creer que todo lo que proponemos, que todo lo que decimos es lo que se atiende. Y considero que esta sociedad, que la verdadera revolución del cambio en materia de salud debe estar fundamentado en escuchar y sobre todo a nuestras comunidades. Entender que el poder popular, que nuestros agentes de cambio son cada uno de esos líderes sociales que necesitan tener un espacio de decisión en nuestras alcaldías, les aseguro, trascienden el tiempo y por supuesto tienen mejores resultados en la vida de todos nuestros conciudadanos. Además de esto, contarles que es para mí muy importante decirles que debemos construir sobre lo construido. Ese ego de poder a veces nos enceguece y nos dicen lo que hoy estamos proponiendo y lo que se venía diciendo ya no es tan importante. Todo lo contrario, siempre cada paso que se da en la humanidad debe reconocerse. Y por eso el mensaje de construir sobre lo construido debe ser una bandera de aquí para adelante en todos nuestros gobiernos. Debemos también guiar, porque los pasos que hoy estamos dando en medio de la dificultad también son valiosos de reconocer y de continuar. Por eso hoy quiero contarles que tenemos el primer acuerdo municipal, el acuerdo 019, por el cual se adoptan los criterios regionales de las Américas para municipios, ciudades y comunidades saludables, y de esta manera lograr que los próximos gobiernos, frente a los pasos que han dado en el anterior tiempo, puedan continuar. Así que es la invitación para todos ustedes para que sigamos avanzando y para que precisamente cuando hablemos de enfermedades no transmisibles sea a largo tiempo, en una línea de planeación y de esfuerzos de todos y cada uno de nosotros.
Muchas gracias, alcalde. Impresionante. Thank you so much, Mayor Medrano. This impressive work just demonstrates that political leadership is not only at national level and national policymakers. It has much more impact when that political leadership comes from the ground, from communities, from cities. And impressive to see that your initiative, your innovative approaches has already generated attention across the region. Impressive work, and I'd much to learn from your experience. We will now close the panel discussions and move to a very important session where we're, as you know, the case studies we've heard just now are part of a broader global mapping report. We have many more experiences. And Katia de Pino Campos, a team member from the GCM, will now present that broader report. Katia, over to you.
Thanks very much, Guy. Can you confirm that you are hearing me?
We can.
Yes,
Very
okay.
well.
Thanks very much. Dear member states, dear colleagues, it's really a great pleasure to speak to you today at this important event for NCDs, which includes the launch of the Global Mapping Report on Multisectoral Action for the Prevention and Control of NCDs and Mental Health Conditions. The report is really the result of a tremendous collaborative effort that brings together the collective support and experience from numerous of individuals. And this report is based on the analysis of the responses that were collected from countries through the WHO call for submissions on experience related to multisectoral actions. And we would like to extend our sincere thanks to the 46 countries, areas, and territories that have submitted the experience to the WHO. and to many other individuals, including my WHO colleagues at the headquarters, regional office, country office, who have played an important role, not only disseminating and supporting the WHO call for submissions, but also in shaping this report. Special thanks to my colleagues at the WHO Collaborating Center for Advancing Health and Health Policies in Australia for their superb collaboration throughout this project, as well as for the World Diabetes Foundation for its financial support. In the next few slides, I will just provide a glimpse of some content from the report. So the developing of this project was a pending task for the WHO Secretariat, and member states have expressed their continued interest in learning and sharing experiencing successes on multi-sector collaboration for NCDs, including understanding how to overcome challenges on implementation of multi-sector actions. So member states not only gave us the mandate to conduct this work, but also reiterated their request at the WHO in 2019. And this global mapping report is our first step and part of a broader WHO initiative to support member states in implementing and sustaining multi-sector actions to accelerate NCD responses. Next slide, please. So this project was actually structured in 2 stages. The first stage involved the call for submissions that I just mentioned and was intended to collect and map country-level experiences on multi-sector actions on NCDs and mental health conditions. The report we are presenting here today is the direct result of this collective exercise. And the second stage involves the developing of the case studies. From the pool of these submissions, WHO selected a handful of experiences, which are now being developed and expanded into comprehensive case studies. These case studies will form the content of forthcoming WHO publication. And this publication aims really to unpack in more detail an examination of how multi-sector actions are being implemented on the ground by member states. Next slide. So to guide this mapping exercise and the developing of the case studies, WHO drew upon extensive experience from health and health policies, other existing frameworks, including the WHO guidance on sustaining multi-sectoral collaboration for addressing the social determinants of health, the WHO Global Action Plan for the Prevention and Control of NCDs. And the result is the guiding framework, which really builds on and supports a WHO toolkit for developing a multi-sector action plan for NCDs. So our focus of this mapping exercise was on the multi-sector pillars, namely governance and accountability, leadership at all levels, ways of working, resourcing capabilities, the blue section of this figure. Next slide. As you can see, a total of 95 submissions from 46 countries, areas, and territories are included in this report. And several countries have submitted more than one experience. You can find more details in the report. Next slide. Let me give just a brief overview of the scope, the kinds of initiatives that are part of this report. Most of submissions report initiatives that address more than one NCD risk factors, and 37% of them address all 4 modifiable risk factors. We also have a number of initiatives on the NCDs, on the disease specific, and most of them cover more than one NCDs or mental health conditions, and 36% cover them all, the 4 main NCDs. Next slide, please. So in terms of NCDs interventions, 93% of the initiatives use more than 2 types of NCD interventions, as highlighted in the Global Action Plan for NCDs, as you can see in this slide. An advocacy and communication campaign was the most cited intervention in the submissions received. Next slide, please. In terms of government sectors, most of the initiatives included multiple government sectors beyond health. And in 68% of these initiatives, between 3 and 10 government sectors were somehow engaged in multi-sector actions. And the education sector was the most often represented across all these initiatives. Next slide, please. Let me turn on to the multi-sector actions. So the report provides in detail the findings of the use of multi-sector actions under each of the 4 pillars, and they are grouped and stratified based on the income level of countries as well as by WHO region. Each of these 4 pillars include a series of actions that aim to strengthen collaboration across government sectors. And based on the information collected through the submissions, most initiatives are using 2 or more multi-sector actions under each of the 4 pillars. Next slide. So in this slide, we have included only the top 5 least cited multi-sector action across the 4 pillars. And you find a more detailed analysis in the full report. For example, the most cited multi-sector action was the establishment of multi-sector coordination mechanism. And the least cited action was having dedicated funding to support multi-sector actions on NCD. And next slide, please. In future directions, efforts will focus on several key areas, including the need for further adaptation of the guiding framework, particularly to boost their support for the WHO toolkit in developing multi-sectoral action plans for NCDs. They will also continue emphasis on evaluating national multi-sectoral action plans with a particular focus on implementation research, aiming at enhancing our understanding on the application of the multi-sector pillars and their impact on policies and programs. Ongoing knowledge sharing will continue as requested by member states and will be instrumental in fostering collaboration across and within countries. And we also continue collecting and disseminating our country-level experience, providing capacity developing and implementing multi-sector actions for NCDs. Next slide. Please check our webpage, Knowledge Action Portal, for you find some future country stories that you can use the QR code on the screen. Next slide. And also, if you haven't downloaded yet the global mapping report, please also use our QR codes on the screen. Guy, I'm done with this presentation. Back to you. Thank you.
Thank you so much, Katia. This is important information, and invite all to access the report and find and analyze those important findings. Dear participants, I'm very sorry to say we will provide we have been providing answers to many of those Q&As that have been coming in through the Q&A. Many have been answered already, but we will pick some of those Q&As and provide attention to answers and responses and resources and links that can address those questions in our Knowledge Action Portal. We'll provide a summary of the meeting with key messages and key comments coming in through the Q&A in the chat. But now, because we are very delayed, we will move into the closing remarks from our senior management and co-hosts. So Svetlana, the floor is yours.
Thank you, Guy, and really thank you very much, dear panelists, dear guests, dear participants, for this very intensive discussion. I am really emphasized how many thoughts we've got and how many efforts we have to do. So because we are really limited of time, let me quickly go and introduce our panelists who will close this meeting, and it is my colleague, Bente Nicholson. Bente is joining us, and she will say about a very important meeting that will take place next week in New York. Over to you, Bente.
Thank you very much. And what an encouraging multi-stakeholder event. Congratulations to all, and congratulations to the global NCD platform and the global coordination mechanism and all participants. And as you say, Svetlana, this is a very special period in the global health time and for NCD. We approach the second high-level meeting on UHC, and you must have noticed that for the first time, we enter a meeting without full agreement from all the heads of states and governments. That said, I think we also for the first time see stronger language for NCD and to address the global burden of NCD and include it into UHC. And that is definitely needed. We saw during COVID how health system was not responding to NCD during COVID times, and the excess mortality that we saw was unheard. So of course, all of us on this call, we know that there is no other way for bringing preparedness to the world than including NCD into UHC and also to primary health care. So we will not achieve UHC without being inclusive, because without being having equitable attention to people with lived experience and affected by NCD. It is the co-creation that will help us to find solutions both through preventive actions, but also through management of conditions through a strong primary health care approach. I know that in the opening remarks today, delivered by our Assistant Director General, Dr. Professor Salomon, he underscored the cross-programmatic, cross-sectoral and stakeholder coherence and collaboration that are so critical to achieve SDG 3.4 and the UHC. So therefore, I think both the report that Katja was just speaking to, but even more important, the real life experience that we have heard throughout this webinar is so important. I'm very happy to see so many stakeholders across the globe. I learned that over 1,000 people had actually registered for this event. So that's very, very promising. So while we have witnesses these powerful success stories from so many countries today that showcase the feasibility of a whole government and whole society response, WHO and partners are ready to continue to build the important capacities on the ground. We need to build capacities in particular on the key pillars for multisectoral and multi-stakeholder collaboration, as was mentioned by all participants today, governance and accountability, and of course with that also data-driven action, leadership at all levels and ways of working, resources and capabilities, and the appropriate funding for NCD. We have heard today clear messages and calls to action that can feed into the upcoming second annual gathering of the Global Group of Heads of State and Government for NCD, discussing the Global NCD Compact. It's happening on the 21st of September next week in New York. So as you may know, the Global NCD Compact calls on action at all levels with all relevant partners to engage, accelerate, invest, align, and account. So today's multi-stakeholder gathering showcases partners coming together to support governments across all these enabling actions. We know that high-level political commitment is a key pillar to ensure coherence in resources, and so we will take these messages to the second gathering next week, turn to heads of states and ask them, how will you as a leader respond to this call to action? How can you motivate different sectors and stakeholders to work jointly on the NCD agenda? As my colleague, Dr. Gordon-Galea said earlier, the clock is ticking. I can hear it. I think you can as well. We need to bring this urgency to engage heads of states to act boldly and quickly. And I think we know the answers to many things if we come together. So again, congratulations on the launch of this year's Global Week for Action on NCD, as well as on the important launch of the Global Mapping Report. It is valuable resources to help us all better understand how we can implement to action. We will make it happen. We can make a lot of things happen if we use this framework, if we focus on what works, the best buys. It is possible. We see it. Please come together. Let's show that it is possible to prevent and control NCD. Thank you very, very much.
Thank you, Bente, and good luck with your event next week. We hope that it will be very successful as usually. Thank you so much. And I think it's you mentioned that the one of the key messages today of our discussion is the urgent measures that we have to do beyond all sectors, not only health, and also to bring the strong government efforts and the leadership on the multisectoral actions. So in this stage, I want to give the floor again to Katie Dane with a couple of words and then go to Bent Lapro-Nielsen also to say a couple of words as they are our co-hosting of this event. Over to you, Katie, and then Bent.
Thank you, Svetlana. I'll keep my remarks short. I think overall it's been really fantastic to hear so many diverse perspectives and experiences represented here today. Really encouraging to see that we're all aligned in the need for whole of government, whole of society approaches in the NCD response. And I think today's gathering has been a particularly strong step in the right direction as it's focused really on concrete examples and inspiring case studies, highlighting what's worked, the progress that's been made, lessons learned, as well as a real kind of sense of optimism, which we need more of, I think, in the NCD response. And I would really encourage all to download the WHO Global Mapping Report for inspiration. It's a fantastic stock-taking tool of what's working in the space of multisectoral as well as multi-stakeholder action. But my final remarks are really to focus on the race to bend the curve on NCDs as we look towards the high-level meeting in 2025. And a reminder, that is also the end date of the 2025 NCD targets that were adopted back in 2012 by governments. And I think if we're to make sure that the high-level meeting in 2025 is a success, to really use it as an opportunity to advance the response, make sure it's anything but a talking shop and instead a commitment shop for governments. We absolutely need to work together across governments, across whole of society, to keep the enthusiasm and the collaborative spirit that we've heard so much of today continuing. But I think also that it's really important, building upon the theme of this event, to ensure that the high-level meeting in 2025 is really engaging well beyond the health sector, that it's essentially not just the NCD community talking to itself, and that we see a tangible shift in attendance and leadership at the meeting, different government ministries coming together beyond NCDs across global health and well beyond the health sector. And I think to achieve this, as we've heard from many of the speakers today, we absolutely need to reframe how we're talking about NCDs to get outside of our comfort zone of our public health narrative and discourse, and to talk the language and the interests of these different sectors: return on investment for finance, climate adaptation and mitigation for the environment, poverty alleviation for sustainable development, and really be reinforcing how action on NCDs will actually support and accelerate these agendas. So thank you very much all. I'd just like to close by also inviting you all to engage with the Global Week for Action on NCDs campaign, follow the events, get involved and really support. Thank you all.
Thank you, Katie, and also good luck with your activities in New York. Bernd, over to you.
Yes, thank you, Dr. Svetlana. And first of all, I think we as co-hosts together with the WHO and NCD Alliance, we had very high expectations for today's event. And I have to say, in my view, we have really almost exceeded the expectation. This was a very, very impressive tour of statements and interventions from countries, so that we could actually see that multisectoral action and multi-stakeholder ownership, it's happening, and it's probably happening more than we know. And that's why the Global Mapping Report launched today is so important. It's a first step on a journey towards 2025 and 2030. But we really need to compile these success stories, disseminate them, discuss them as we've done today. And hopefully today was one of those milestone achievements which will bring our joint response to the NCDs and the work towards UHC in an accelerated pace. Because when we go to, when we see the the discussions next week at the UNGA, we shall remember that what it's all about is to see those patchworks of progress at the country level elevating up to a global, you can say, united effort, as I said in my opening remarks. Also, many thanks, of course, to the GNP platform and the GCM for taking the lead on this multisectoral work stream. This has been something in the making for a long time, and it will go on because it's of such importance to the NCD response that it deserves much more attention. At least from our side in the World Diabetes Foundation, a great message of appreciation to those voices we heard today from a range of countries. That was a snapshot. There's much more to learn from, but this was a brilliant start. And with that, I wish to again express our gratitude for being part of co-hosting this very unique event, which hopefully we can build and grow, from here. Thank you very much to all, and back to you, Svetlana. Thank you.
Thank you very much. And once again, I would like to thank NCD Alliance and World Diabetes Foundation for co-organizing this event. It was really a great pleasure to work together with you and with your team. And thank you very much, our distinguished speakers, panelists, and the invited guests, and all the participants who worked with us. Good luck, be healthy, and let's stay in touch. Thank you very much, and goodbye to all of you.